First aid, a skill we all should have, but those see us in possess that is yes, but that few truly master. Today, we'll explore how a simple manual can mean the difference between life and
That
death.
sounds intense. Which manual are we talking about exactly?
Well, we will dive into a fascinating manual from the Autonomous University of Yucatan. It is a comprehensive guide on care in urgent and emergency health situations, and let me tell you, it's like having an intensive emergency medicine course in your hands.
Interesting. And why is this particular manual so important?
You see, this manual is not only an educational tool for future health professionals, but also emphasizes the importance of being prepared to act in critical situations that can occur in daily life. We are talking about cardiopulmonary arrests, severe injuries, and other life-threatening events.
That sounds quite serious. What kind of information does it provide exactly?
Well, it starts with the basics, defining the difference between emergencies and urgencies. Emergencies are like a flashing red light. They require immediate attention and can be life-threatening. Urgencies, on the other hand, are more like a yellow light. They need attention, but do not pose an immediate life risk.
Oh, that's an important distinction. I suppose knowing the difference can help prioritize attention in situations.
Exactly. And speaking of being prepared, the manual emphasizes the importance of having a well-equipped first aid kit. We are not just talking about a few band-aids and paracetamol, but a portable mini hospital.
That sounds useful. What should such a kit contain?
Well, the manual details that it should include antiseptics, dressing materials, basic instruments like scissors and tweezers, and some essential medications. But, the most important thing is not just having it, but knowing how to use each item.
Makes sense. And does the manual teach how to use all that?
Absolutely. In fact, it introduces a very useful mnemonic for assessing a patient in an emergency. A B, C, D, E. It's like a mental map that guides you amid the chaos.
Interesting. Can you break that down a bit more?
Sure, A is for airway, B for breathing, C for circulation, D for neurological deficit, and E for exposure. It's a systematic way to quickly assess a person's condition. And speaking of assessment, the manual also emphasizes the importance of vital signs.
Vital signs. Those basic indicators that we sometimes overlook, but that reveal a lot about our health status. Right?
Exactly. The manual mentions four main vital signs: heart rate, respiratory rate, body temperature, and blood pressure. They are like the control panel of our body.
And I suppose knowing how to interpret these signs can be crucial in an emergency.
Totally. But the manual doesn't stop at Siri. It also covers practical aspects like patient transportation and movement. It's something many people don't consider until they're in the situation.
That makes me think. What if we try to help but end up making things worse?
Good question. The manual emphasizes the importance of safety for both the patient and the rescuer. It describes specific techniques for lifting and moving an injured person, and it is crucial to know them to avoid further injuries.
That makes sense. And what about specific injuries? Like fractures or burns?
The manual covers all that. It talks about musculoskeletal injuries, how to identify them and provide initial treatment, including proper immobilization. It also dedicates a section to burns, classifying them according to their depth and extent, and provides clear guidelines for their treatment.
It seems to cover a lot of ground. Is there anything else that stands out?
Oh, definitely. The manual also covers situations like seizures, heat stroke, and airway obstruction, but perhaps the most crucial is the section on cardiopulmonary resuscitation or CPR. Yeah.
CPR. That's something we've all heard of, but few of us really know how to do, right?
Exactly. The manual provides a detailed guide on how to perform CPR on adults and children. And this is where it gets interesting because it highlights the differences between CPR for adults and for children.
Oh, I didn't know there were differences. Can you explain a bit more?
Sure. In adults, the oxygen content in the blood is usually normal during cardiac arrest, so chest compressions alone can maintain an adequate supply of oxygen to the heart and brain in the first few minutes. But in infants and children, cardiac arrest is often associated with previous respiratory failure, so it is crucial to perform both compressions and ventilations from the start.
That's fascinating and potentially vital to know.
Totally. The manual even details specific techniques for infants, such as the 2-finger compression and a sequence of 30 compressions followed by 2 ventilations. It's information that can mean the difference between life and death.
It's incredible how much detail this manual provides. Do you think this type of knowledge should be more accessible to everyone?
Absolutely. This manual is part of the training for health professionals. But imagine a world where every person had these basic first aid skills. It would be like having a safety net throughout the community.
That sounds like an inspiring vision. How do you think we could bring this kind of knowledge closer to ordinary people?
Well, I think the key lies in education. We could start by including basic first aid courses in schools, offering community workshops, or even creating interactive mobile apps that teach these skills in an accessible and engaging way.
Those are great ideas. And speaking of applications, do you think technology could play a more important role in emergency situations in the future?
Oh, definitely. In fact, we are already seeing progress in that direction. Imagine wearables that can detect abnormal vital signs and alert emergency services automatically, or augmented reality that can guide you step by step in performing CPR in real time.
That sounds like science fiction, but I guess that's where we're headed.
Exactly. But at the end of the day, technology is just a tool. The most important thing is knowledge and preparation. And that is what this manual and our conversation today aim to promote.
Totally agree. It's fascinating how a simple manual can contain such vital information.
That's right. And I think that is the most important lesson we can take from all of this. Knowledge saves lives, literally. Every small piece of information we acquire about first aid makes us more capable of helping in an emergency.
Well said. And I hope this conversation has inspired our listeners to learn more about first aid and emergency care.
I hope so too. And with that, I think it's a good time to conclude our episode for today. Remember, dear listeners, that knowledge is power, especially when it comes to saving lives.
Exactly. And as we always say on Podcast Mania, you never know when a small piece of information can make a big difference. Thank you for tuning in today.
And remember, stay safe, stay informed, and see you in the next episode of Podcast Mania.